Hello everybody, my name is Laura and I'm a doctor. I'd like to tell you all about the job that I do and that my friends do. There are lots of different kinds of doctors and nurses. Some of them work in hospitals and I work in a GP surgery. That means I get to see lots of different people. We look after little babies and we look after older people, and our oldest patient is 100 years old. I work with doctors, nurses, paramedics and many other people. We have two different things that we do here. One of them is to help people stay healthy and the other one is to look after them when they're poorly. There are all sorts of things you can do to stay healthy, like exercising, drinking water and eating healthy things like fruit and vegetables. Sometimes people don't know how to do this and they need some help to find out what the best things to do would be. And we help them to do things that they're really going to enjoy to keep healthy, like learning how to dance and play and sing. We can tell them where to go to be able to do these sorts of things, and we even have a choir ourselves where the doctors and the nurses and the other people go to sing and make them feel healthy and better. If you are feeling poorly, like if you have a tummy ache, then we can help you to feel better. The person who looks after you would call us at the surgery and we would talk to them about what was wrong with you. For example, you might have a tummy ache and we can ask them what sort of tummy ache it is. We would often then need to see you so we can work out what the best way to make you better would be. You then come down to the surgery with the person who looks after you. We're very friendly and would like you to ask as many questions as you have. We use all sorts of things to try and find out what's wrong with you. We use this to look into your eyes and into your ears. We use this to learn about your heart and your breathing, and it goes on your finger. It's all squidgy inside so it doesn't hurt. And this is my favourite thing. This is my stethoscope and I use it to listen to people's hearts and to listen to their breathing, and I sometimes even put it on people's tummies to make sure it's making the right noise. When we have found out why you are feeling poorly, we then work out what to do to make you feel better. We sometimes give you medicines to make you better and we choose the best ones that will work for you. Sometimes people have worries and this makes them feel poorly. And we talk to them about their worries and how we can help, and this makes them feel better. Some people have problems that last a long time, and our nurses are very clever and good at making sure they have the right medicine or advice so that they can do all the things they like to do, like PE and sports. Some people have something called asthma, and you might know of somebody who has this too. They can need to use a special medicine called an inhaler. Our nurses make sure they have the very best inhalers and that they know how to use them. Some people aren't able to come to the surgery when they're poorly and we go and see them in their houses. I work with somebody called Lily who is a paramedic and she does a lot of this. We're going to meet her a little bit later and she's going to tell us what she does. I like my job for lots of reasons. I like meeting people and hearing nice stories about their lives. I really like learning, and you get to learn something all the time when you work as a doctor or a nurse. I really like the human body. Did you know that if you accidentally cut yourself, your body will make skin and it will all get better on its own? The very best thing about my job is I get to help people. I really like helping people and it's a lovely thing to do, and I get to do it every day, which is really, really good. I hope you've enjoyed learning about what we do here. We're going to go and meet my friend Lily just now. She's going to tell us about her job too. If you have any questions at all, please ask your teachers or your TAs and they will ask us and we will get back to you. Goodbye everybody.
So my name's Lily, I'm a paramedic and I currently work at the doctor's surgery, and I help the doctors to see all the poorly patients who can't come into the surgery. Before I worked at the doctor's surgery, I worked on ambulances, which was really exciting. That meant that we could drive around to poorly people's houses, and sometimes we use blue lights and sirens, so you might see us driving past quite quickly and you can give us a wave. We quite like that. And it also meant that sometimes I was able to go on a helicopter to fly to patients who were very, very poorly. And it's a really exciting job. I get to meet lots of different people and try and make them better. And sometimes we take people to hospital so that they can see the doctors there. But lots of the time we leave people at home and we try and make them better at home. Okay? So some of you might have had to travel in an ambulance or meet paramedics before, so I'm sure you know that it's not a scary thing to do, and we're all really friendly and you can ask us lots of questions. Goodbye.